Imagine a world where incurable diseases can, in fact, be cured. Where failing hearts can be strengthened without surgical transplants or donor organs. Where victims of devastating diseases like ALS can receive effective treatment and hope. This is the promise of regenerative medicine. Science has long known that the human body responds to injury and disease by attempting to heal itself. Regenerative medicine accelerates this natural healing process by harnessing advances in biology, immunology, and other sciences to restore health and function to damaged tissues and organs.
Regenerative medicine is truly a game changer.
If we can take a patient's own cells and get them working on the patient's problem, we could have a tremendous amount of impact on the care of medicine.
This is something we need now. We see, this is the end of the line for a lot of patients for some wounds, and I think this is something that's very easily translatable to the bedside.
Recognizing the vast potential of this emerging field, patients are already benefiting from proven regenerative therapies. For example, physicians use materials from the patient's own body to assist in the healing process. Dr. Rafael Sierra uses a similar approach when treating certain patients with osteonecrosis of the hip. Osteonecrosis is essentially the death of bone material, sometimes caused by the use of chemotherapy in cancer patients.
It's a very simple procedure where we take bone marrow concentrate that's obtained from the iliac crest of patients with osteonecrosis, and through a hip decompression, that's a trocar and a sleeve that's placed into the femoral head, we're able to deliver these cells into the dead bone with the hopes of regenerating, but most importantly to improve pain. These patients have a lot of pain, and the pain improves with the decompression procedure, and it seems to be even further improved with the injection of the bone marrow concentrate. This is a step towards trying to hopefully treat a problem that for the most part has been untreatable for many decades.
These regenerative therapies are meeting patients' needs today, and Mayo physicians and researchers have many new ideas in the pipeline. In another trial, cultured stem cells are being used to heal painful perianal fistulas in patients with Crohn's disease.
We have about 500,000 patients in the U.S. who have Crohn's disease. About 20% of those will have perianal fistulas, and we really have no good treatment currently for that problem. So this trial is really designed to help wound healing in those patients who have this bad problem of fistulas. Now in surgery, we have a lot of patients who have trouble with wound healing. So I'm very excited about the ability of regenerative medicine to help patients that we struggle with on a daily basis, patients with terrible infections, patients who've had burns, patients who've had major cancer surgery and have huge tissue loss, trauma patients. All these patients may benefit from a program that allows the body's own cells to regenerate and replace that normal tissue in patients that have tremendous tissue loss. So it's a very exciting area for me as a surgeon in an area that I struggle with almost on a daily basis.
Dr. Stephen Moran is researching how regenerative medicine can help heal wounds to skin and tendons through the use of spherically engineered bioscaffolds.
Chronic wounds is a huge issue in the United States. It's a $4 billion cost to the American public in terms of managing these things. And they develop from all kinds of different traumas, whether it's burns or chronic wounds, diabetic wounds.